Hello, I'm Eric Bowen. I'm one of the staff cardiologists at National Park Medical Center. Atrial fibrillation is a disorder of the upper chamber of the heart muscle. The upper chamber starts the electrical impulse to the bottom chamber. Atrial fibrillation is one of the many arrhythmias of the upper chamber, but it tends to be more critical because there's a higher risk of stroke with atrial fibrillation, about 10% a year in patients who are not taking blood thinner. So if a person does have atrial fibrillation, it is different than most arrhythmias. Typically, when people have heart arrhythmias, they're going to typically have fast heart rates, which typically turns into symptoms of fatigue, shortness of breath, or they may even have palpitations or feel like a racing heart. If the heart rate gets high enough, they could actually have dizziness or actually black out. The bulk of the time, atrial fibrillation can be treated with medications. Some medications actually slow the heart rate down. Some medications actually get you back into rhythm. And as I said earlier, most patients need to be on blood thinner until their heart rhythm normalizes and they're back in rhythm. If we can't control the rhythm with medications, sometimes we refer people for a technique called ablation. That's where we actually go in and cauterize these abnormal signals in the heart muscle to try to restore normal rhythm. Atrial fibrillation over time could actually cause issues with early heart failure. If the heart's not pumping properly and the heart rate's not well controlled, it could put a strain on the heart. Typically, if a person has atrial fibrillation, they need to be referred to a cardiologist, again because the higher incidence of stroke compared to someone who does not have atrial fibrillation.